the holidays gave me a little bit of weight. I love Dr. Angelina and her entire staff. They've always welcomed me with open arms, and they absolutely love me, and I love them back. I am not a person who likes to go underneath the knife. I'm not that person. I don't frown on anyone else who wants to do it. I think if you're going to do it, you do it, and that's wonderful. However, I like the alternative portion of it. I like to take Ozempic so that I can be skinny, so I can be fine. But I don't want to lose all my curves because I'm a 50-year-old woman. You got to have, my mother said, you have to have a little bit of sick weight just in case, just a little bit just in case. However, I love it because it's, it just helps me, and then of course when you go see her, even if it's a virtual situation, that she'll tell you that it's a gradual thing, and then you can't just stop. I'm raising my hand because you can't just stop, because what will happen is your body goes into a shock. Just for me, in my experience, your body goes into shock, right? And then you gain your weight back. So you gotta stay persistent. If you're gonna do it, you have to stay persistent and gradually get your body back to where it needs to be. So I just wanted to tell you guys, I am an advocate. Hey, hello, raise my hand. I love it. I love it. I love being skinny. So thank you so much, Dr. Angelina. Thank you for coming.
I would love to ask you the biggest question that we hear on lives and on TikTok. What do you eat?
Well, I still eat. I sometimes eat, but it's not like I'm not a glutton. When I'm finished, I'm finished. That's just like with anything. And then I saw something on Instagram, and it said that if you can control your eating habits, you can control anything in your life. So I think even with taking Ozempic, it helps with all aspects of your life. It helps you with everything. That's what I think.
I love it. I feel like we need more. But how do you feel like it helps you control? Like, do you think it helps your brain with like choosing what you want to eat?
I think it helps with everything. Yes, it helps with everything. I love food. The only thing that I don't eat is pork and nuts. The ones that you grow. But you know what I mean? I love food. Food is delicious. I love sweets. I love vegetables. I love all types of food. So, I just eat what I want. And that's the beauty of it. You can eat whatever you want to eat, and it helps your brain and helps your whole body to maintain. I think that's the greatest thing.
I love it for the same reasons.
Thank you.
What about when it comes time and you lose a certain amount of weight and you feel like you need to make, what's wrong?
No.
Okay. What about when that happens and people have a lot of skin or their body has changed considerably and you're trying to make a decision if, it's right for you to go under the knife, right? If you're gonna make that decision. So when people are coming to you and they're trying to have that conversation, like how do you help them come to decide if it's right for them?
Great question. So essentially, I usually tell all my patients, you have to consider your weight loss journey, particularly if you've lost significant amount of weight. The weight loss journey is essentially complete after you address the excess skin. Because frequently what will happen is, let's say you lose 50, 70, 80 pounds, while overall health will improve, such as medical conditions like diabetes, high blood pressure, high cholesterol, sleep apnea, now there might be some psychological aspect of the loose skin that can now affect your overall well-being, such as having chronic rash, difficulty in clothing, difficulty with sexual relationship, and that can negatively impact the health because that creates stress, and your body, as a response to stress, secretes extra hormones like cortisol that can sort of rebound and create more weight gain. So I tell patients, consider the weight loss journey complete once you've addressed the excess skin. And in terms of deciding when to undergo surgery, you should do it really when your weight is stable. So you can't do surgery when you're gradually losing weight because then your need for revision goes up. So once you're at a stable weight,
I will
and you
have
can,
a whole TikTok and YouTube video about all of that, by the way.
okay.
I have
So-
examples.
Then you can start addressing the body parts that concern you. Historically, we start with the abdomen because when you do a tummy tuck, that addresses a lot of problems right away, such as elevating your mons, the area just above the vagina, addressing the redundant pannus, addressing your flanks, tightening the abdominal wall. And we know multiple studies have shown if you tighten the abdominal wall, it improves a lot of function, such as bladder function, increase your core strength. Also, lower back pain tends to improve because you're removing all that weight from the lower abdomen. So and then your clothing gets easier to fit on. You get no rashes. All those problems are addressed. Then you move on to the next step. And in terms of addressing all your skin-related problems, it's never just one surgery, right? You have to do it in stages for safety. You don't want to be under the knife for like 10 hours. That's unsafe, unsound, and you're essentially guaranteed a complication. We like to historically stay below 5 hours for an elective cosmetic procedure.
Okay, I have a question.